We next want to look at some genitourinary conditions or disorders. And the first one I want us to talk about is cryptorchidism. This is undescended testicles. Remember that the testicles normally descend about 8 months of gestation. So babies born before this time will probably have cryptorchidism, and sometimes babies born after that time will as well. Sometimes they come down on their own. Sometimes we give them a drug called chorionic gonadotropin. Other times surgery called an orchiopexy is necessary. Now with an orchiopexy, the physician goes in and pulls the testicle down from the abdominal cavity into the scrotal sac, puts a little button-like thing on there and says, okay, stay here. And this is usually outpatient surgery. The parents are told to keep it clean, leave that little button-like device in place, and when they go back to see the doctor in a week or two, the doctor will remove that. And the testicle now knows where its new home is. Another condition I want us to talk about a little bit is hypospadias and epispadias. This is where the urethral opening or the urethral meatus is not at the end of the penis where it's supposed to be. It's either on top of the penis or underneath the penis. It's often nurses that pick this up because you'll note that the baby's urinary stream doesn't go the way it's supposed to. It either goes up or down. The only really thing in terms of care for this child that you probably need to remember is this baby is not a good candidate for a neonatal circumcision because the foreskin is the perfect repair tissue. So this child should not have a neonatal circumcision. It's not life-threatening. Most children do very well. Surgery is usually done at least before they go to school so that the other children won't tease them and laugh at them. I also want us to look at a Wilms tumor. A Wilms tumor is a tumor of the kidney. It probably began in the fetus, but it's not usually diagnosed until the child is a year or two or even 3 or 4 years of age. Now, this tumor is an interesting tumor because it's an encapsulated tumor. So this tumor is within a capsule, unlike most tumors. Because it's encapsulated, it's contained. So if it's diagnosed early and it's not spread, oftentimes the children do quite well. But the major point of nursing care for someone with a Wilms tumor is we don't want to break that sac around there. Because if that capsule that this is in breaks, then you've seeded the child's abdomen with cancer cells. So there'll be a big sign on the bed that says, do not palpate abdomen. And that will be there until the child has surgery. And the surgery is usually going to be the removal of the kidney, and then this is followed by chemotherapy. If that capsule has not broken, the child has a very good prognosis. If not, then the prognosis, if it has broken, then the prognosis isn't usually as good. The surgery will be done almost immediately after the diagnosis because of the risk of breaking the capsule.